Hello, everyone, and welcome to our Health Talk. My name is Alina, and my pronouns are she and her. On behalf of Patient Education and Engagement Program here at the University Health Network, thank you for watching this session on pharmacy. At UHN, we strive to provide safe and inclusive care, and that begins by honoring Indigenous peoples. Indigenous peoples are the original inhabitants of this land and for thousands of years have cared for this land. Although we are presenting this health talk on pharmacy in the digital world today, we want to acknowledge and remind ourselves and also encourage you to do the same wherever you are currently located, that we are still on the traditional territory of many nations, including the Huron-Wendat, the Haudenosaunee, and the Mississaugas of the Credit River. This territory is governed by the Dish with One Spoon, Wampum Belt Treaty, an agreement to share for, care for, and protect the resources around the Great Lakes in peace and respect. Today, this territory is still home to the many Indigenous peoples from across Turtle Island. Land and medicine have a strong connection to Indigenous peoples. At UHN, the Gittigan Garden at Michener Institute grows plants that are used in healthcare for patients across UHN and sometimes given out to the community. The four sacred medicines of tobacco, sage, sweetgrass, and cedar are all from this land and have an important connection to medicine and healing for Indigenous peoples. There are many ways that Indigenous peoples may receive care, which includes traditional and Western medicines. Through the Gittigan and the Indigenous Health Program, we are actively learning how to bring Indigenous cultures and traditional medicines into our healthcare system. I myself commit to learn more on how we can provide best access to cultural supports and encourage you to do the same. We are thankful for the opportunity to work and learn on this territory and are grateful to Indigenous peoples for being the original caretakers of this land. Thank you to those who have submitted questions. Normally, this would be a time when we would ask you to submit your questions for our speakers today, but because we're doing things a little differently, with our new format, you can start to submit questions at the beginning of each month. This will help us ensure that we are speaking about most of what you would like our guest speakers to talk about and tailor their presentation to the questions being asked. And now moving on to our presenters. We have three great presenters today. Alice Williams recently retired from a 30-plus year career in corporate communications. She's a patient partner volunteer with UHN. She's also a mom to two young adult kids, aged 19 and 23, who both live with chronic liver conditions. JD is a pharmacist at the Toronto Western Family Health Team here at UHN. JD has worked in the family health team setting for 10 years and has a special interest in diabetes care. She's also involved in the smoking cessation program as well as the sleep therapy program at the Toronto Western Family Health Team. And Eugenia is a registered pharmacist and graduated from the University of Toronto. She recently earned her master's degree in health administration and community care from Toronto Metropolitan University. Eugenia joined University Health Network in 2015 and is now the Outpatient Pharmacy Site Operations Manager at Toronto General Hospital. Over the years, Eugenia has been involved in many educational seminars in collaboration with various different partners. So we have a great group of speakers today, and this is what we're going to be talking about. So as of October 1st, 2023, pharmacists have seen an expansion in the conditions they can provide for minor health issues. Today, we'll hear a personal experience from a patient partner on medication management and accessing pharmacy services. We'll talk about how a pharmacist is involved in your healthcare, tips to manage medication, having conversations with your pharmacist and healthcare provider to navigate your healthcare, and also share resources that are available here at University Health Network and in the community. So with that, I'll hand it over to Alice now to start us off.
Thanks very much, Alina. Appreciate it. Hi, everyone. My name is Alice Williams. As Alina said, I am a patient volunteer with UHN, and I'm also a mom to two children who have chronic liver conditions. Just very quickly, I will share my children's health journey and how our involvement to UHN came to be. Both my kids are followed by Toronto General Hospital, my son at the liver clinic and my daughter at the transplant center. So next slide, please. Both my children have a condition called Wilson disease. It affects approximately 1 in 30,000 people worldwide. It's a genetic defect that is passed on by both parents. And essentially, the liver is unable to process copper. From birth, copper will start accumulating in the liver, and the liver is unable to process and secrete it. Over time, this essentially becomes poisonous to your body. It can result in extensive liver, neurological, psychiatric symptoms and damage. Next slide, please. Usually, symptoms appear late adolescence, early adulthood, but they can happen at any age, children all the way up into your 50s, 60s. There is no cure. Patients have to be on medication for the rest of their life to remove or sustain stable copper levels. Some patients require a liver transplant if the liver is so damaged because of the copper poisoning. So, thanks. Very quickly, my daughter came home from university Christmas last winter. Her symptoms came on fast and furious. She was diagnosed very quickly. Unfortunately, her liver was so damaged that she required an immediate transplant, which she had at Toronto General in January. She, as I mentioned, is now a lifelong, patient at the transplant center, and we get our meds from the transplant pharmacy at TGH. We had her brother, my son, tested. He too has Wilson disease. He was diagnosed in February this year. He's followed by the liver clinic and receives his meds from the outpatient pharmacy at TGH. So I have experience working with both pharmacies, and I just have the utmost faith, confidence, trust in each. I like that they're directly connected to the hospital where my kids get their care. I feel like they probably know the doctors, the medical staff, there's a familiarity there. The service is fantastic. You can renew meds online. You can call 24/7, renew online 24/7. They have free delivery across Ontario if you don't want to make the trek to Toronto General and pick them up. They make it very easy. I also like that they have a medication and reimbursement specialist. So if you need help or have questions about insurance, whether that's public, private, drug coverage, they're there to help you navigate that system. My kids, as you can imagine, their meds are vital to their ongoing health, which they both take twice a day. They really can't miss one dose without potentially serious consequences. Thankfully, they've let me take care of ordering their meds, as their, pseudo caregiver. What I like too is the pharmacies have an automatic reminder system, so you can, sync it with your own calendar to ensure that you never miss a refill. Because as we know, refills are so critical. My children really don't have a window to miss doses. I sync that with my own calendar, my phone calendar, my written calendar, so I'm always sort of ahead. And I try to build in about a week buffer. As we know, meds might take, I believe they say 24 to 48 hours or even a few business days. So to build in a week buffer to make sure that, again, you don't miss the renewal. As my kids' doctors have both said to them, the meds work if you take them. We bought each child a fancy watch with an alarm so they can set their alarm for the morning and the evening. I've also suggested they put a reminder in their phone, just a little pop-up message, time for meds. Few other tips, like all of us, they're busy, they're working, they're going to school, they're hanging out with friends. They're rarely in one place. So I bought them a few pill packs that they can put in their knapsack, their purse, their overnight bag, so they don't have to worry, oh, I'm hanging out at a friend's house tonight, oh, it's 9 o'clock, forgot my pills. It'll be in their purse or knapsack, wherever. Luckily, they've settled into a routine. They take their meds with breakfast and in the evening. So I think, just like many of us, it's part of their routine as they take breakfast, they take their meds. I know for me, I take a morning med and I always make sure I put my pill bottle on the kitchen counter the night before. So I see it in the morning, sort of a visual reminder. I'm tempted to remind them, but as a mom to two young adults, I think they were really tired of my nagging, so I appreciate that. Luckily, they do blood work quite regularly, and if there's any issues, it'll show up in the blood work. Thankfully, there have been none. So what's interesting, there may be times where they're prescribed other meds. They have a family doctor, maybe they'll end up in emergency with a broken leg. We don't know what happens. We were advised, and it makes so much sense to me, that if they are prescribed any other meds, to check with the primary pharmacy team at TGH, whether it's the outpatient pharmacy or the transplant pharmacy. And I kind of view those meds as my children's primary meds. Again, they're so critical with a rare disease and a liver transplant. I think it's great to speak to the pharmacy team, who can advise if there's any potentially negative reaction or interactions with their primary meds. So I can't say enough good things about either pharmacy. It's just nice to know. It's also nice to know that some of the proceeds go to support educational initiatives and research. So it speaks to why TGH is one of the 5 top hospitals in the world. I'm forever grateful for the excellent care both my kids receive and the great experience I've had with both pharmacies.
Thanks, Alice. We really appreciate you sharing your story with us. It's definitely going to help anyone who's caregiving to a loved one, or even who are patients themselves. As we move on to talk about services a pharmacist offers, we wanted to provide some information on where you can find a family doctor or a primary care provider. Healthcare Connect is a great place to start. It's a free resource that you can use and available in multiple languages. You can call 811, it's a toll-free number, to reach Healthcare Connect, or you can go to their website to chat with someone online about finding a healthcare provider near you. Community health centers and family health teams are also a great resource to connect with to find a family doctor. And with that, I'll hand it over to Eugenia now to start us off.
Thank you, Alina. And I also want to thank Alice again for sharing your experience at Toronto General Hospital with my outpatient pharmacies. It really does highlight the importance of pharmacy in a patient's healthcare journey, and how much of a difference pharmacy can make in everyone's daily lives. So today I want to talk about the services that pharmacists can provide. These are known as expanded scope services. I will also explain some of the everyday things that we do that can make a difference in your medication management. So as medication experts, pharmacists definitely play a big role in your health. So really the most important thing that we do is to ensure that your medications are used in a safe and effective way. So some of the questions we may ask you on a daily basis is the medication appropriate for your treatment? Are there any drug interactions with your other medications? And this would include supplements that you might take or natural health products, which are quite popular nowadays. And the question, are there any side effects or safety concerns that you specifically need to be aware of? And by asking all these questions and collecting the answers, what we also try to do at the same time is to ensure that medications are aligned with your personal health goals and your preferences. So all pharmacists go through similar education and training, so we all kind of have the same knowledge and expertise. However, there are differences between the types of pharmacists, and myself and JD today, we actually represent 2 different types of pharmacists in different pharmacy settings. Because our workplace provides different services, we may help you with your medications in a slightly different way. So myself, I'm a community pharmacist. We typically work out of a pharmacy in the community. And in my case, it's an outpatient pharmacy, which is also within the community, but it's inside a bigger hospital. The major difference between a community pharmacist and a family health team pharmacist is community pharmacists can give out medications and injections. So we can write prescriptions, we can give vaccines and injections as well. So for a family health team pharmacist, typically they work within a clinic. The difference is they don't give out medications. And family health team pharmacists generally only see patients who are part of a family health team. And JD will go into more details about this later on in the presentation. So a bit more clarification on what outpatient pharmacy is. So Alice mentioned in her experiences with Transplant Outpatient Pharmacy and Toronto General Outpatient Pharmacy within Toronto General. So these are basically community pharmacies inside a hospital setting. Just like any other community pharmacy, we identify, we resolve, and we prevent drug-related problems. I guess one major difference is we are heavily involved in the patient care process because similar to Alice's case, outpatient pharmacies often support patients transitioning from being admitted or being in the hospital to going back home after discharge. So we work hand in hand with the inpatient pharmacy team, with the doctors, the nurses, coordinators, and any other hospital personnel, just to make sure that we are actually providing the best care for you. In addition, we also have additional access to inpatient and hospital information. So that would be our hospital systems such as Epic, and that allows us to see medical histories, any lab work that might be relevant to the medications and the doses that you're taking. And this is really helpful and something that local pharmacies do not have access to. So over the years, the role of a pharmacist has really changed. In the past, pharmacists were really limited to the more traditional activities like dispensing medications, checking medications, etc. But given our knowledge and our expertise, we are now performing many more activities that really directly benefit patients. So you might be asking, what can a community pharmacist do? One of the main services that we can provide are consultations, so also known as meds checks, or consultations which happen one-on-one, and they can happen as frequently as once a year. Basically, during this interaction, we talk about compliance. So are you taking your medications correctly? Are you taking your medications regularly? And we discuss any interactions between your medications, any supplements you might be taking, or any natural health products. The service is free for anybody in Ontario with a valid health card, with a chronic condition, and who is taking more than three or more medications. The service is also free for those with type 1 and type 2 diabetes. We can also suggest changes to prescriptions while working with your family doctor. So this is what we call pharmaceutical opinions, where we identify potential drug-related problems, and we may recommend certain changes to the prescription, based on the information that we find out or upon review of your prescription. So our recommendations can be accepted or rejected by the doctor. So prescription therapy can be dispensed differently, or just as is. So what can we do with prescriptions now? So three main things. The first is starting a prescription or writing a prescription. We are limited to being able to do this with smoking cessation, counseling, and recommendations, and also minor ailments, which is your everyday health conditions that can be easily treated. And I'll go into more details later on about this. The second thing is changing prescriptions. So whether it be a dose change, dosage form change, so from tablets to a capsule or to a liquid, the treatment itself or the route of administration, so by mouth, etc. So this is very helpful because often there are drug availability issues. So I'm sure you're all aware of backorder issues with medications nowadays. And often we do see minor errors in prescriptions. So it's very helpful for us to be able to make corrections without having to reach out to the doctor and wait hours, and in some cases even days for the doctor to get back to us. However, one thing I do know is that we cannot help you make a change from one drug to another. So the third thing we can do with prescriptions is to help renew them. So I'm sure a lot of you have had experience with this as well, where you've gone into a pharmacy for a refill and you realize you don't have any refills left. So we can actually help you with that, but we do need to do a thorough assessment for current medical conditions, check if you have any side effects, etc., before we can actually renew the prescription for you. And often we can renew up to 3 months at a time. So apart from prescriptions, we also provide vaccines and injections. For general vaccines and injections, we provide medications for patient teaching purposes. And for some general vaccines, we do provide the administration of the vaccine itself to patients 5 years of age or older. And in terms of flu and COVID vaccines, I'm sure many of you have used this service already from your local pharmacies. But pharmacists and pharmacy technicians can both actually provide flu and COVID vaccines to you. Now, who are pharmacy technicians? So these are regulated pharmacy staff who help in the pharmacy for duties such as dispensing and product checking, etc. So apart from vaccines and injections, we also provide services teaching you how to use your inhalers. So this is not something new. We've been able to do this for quite a while already. So next is minor ailments. So you might be wondering, what are minor ailments? Might have heard on the news from October 1st that pharmacists can now write prescriptions for even more health conditions, or known as minor ailments now. So these are health conditions that can be managed with minimal treatment and or self-care strategies. So things that you can do on your own to get better. So these conditions are usually very short-term, so they don't last very long. And for these conditions, visiting a lab is usually not required. So that means we're not waiting for blood work or lab results to determine what medication you're taking or what dose you need to be taking. It is also important that you're not on any medications or you have a medical history that indicates a more serious condition. Because if that is the case, then we cannot provide minor ailments prescribing for you. Now, to note, pharmacists cannot prescribe controlled substances. So these would include narcotics, controlled substances, and targeted substances. And what's the reason for this? Well, we reviewed earlier that the definition of minor ailments is simple medical conditions that don't really require in-depth review. Narcotics, controlled substances, and targeted substances are usually for more complicated conditions and therefore wouldn't be part of the medications that a pharmacist can prescribe. So here is a list of all the minor ailments that pharmacists are authorized to prescribe medications for. So as you can see, these are everyday common problems that you experience and that you probably don't want to wait hours for to see a doctor in their clinic. So last but not least is point of care testing. So this is basically testing using medical devices that involves the poking of the skin, usually using a lancet device or some kind of needle tip device to obtain a drop of blood or two. And this is for measuring things like your blood sugar or A1C, your cholesterol or lipids, and your blood's ability to clot, also known as INR or prothrombin time. So apart from a pharmacist, an intern, a registered pharmacy student, or a pharmacy technician can also provide point of care testing. So this is really helpful for when pharmacies or when certain clinics host certain clinics where they can do this kind of testing for you in order to obtain more information to figure out, what kind of additional care that they can provide you. So after discussing all the expanded scope services that a pharmacist can provide, you may be wondering, what can you do to help work with your doctors and pharmacists? So things you can ask your doctor or pharmacist are questions about the medications you will be taking. So better understanding the medications and fitting it with your daily routine. You can also find out if there are any lower cost options for your medications. And this would probably involve more discussions with your pharmacy. And if your pharmacy has a medication reimbursement specialist, like our outpatient pharmacies do, they would be a great resource for you. It is also very helpful to keep a list of allergies, vitamins or supplements you might be taking, and any medications you're on. Have that with you so that you can always show your doctor or your pharmacist whenever you see them. You should also always ask when you should follow up with your doctor or your pharmacist for your medications. So these are generally tips you can follow to advocate for yourself and to help us provide the best care possible for you. So now I'm going to hand it over to JD to talk about the family health team.
Thank you, Genia. So I'm JD. I'm the pharmacist at the family health team at Toronto Western FIT. We all call family health team a FIT. Its acronym is FHT. Don't ask me why, but that's how we pronounce it. So I will be referring to myself as a FIT pharmacist, and that's what I mean. So I don't work at a physical pharmacy, but instead within a family health team. So just a little bit more about what a family health team is. So for those who are not familiar, the idea of a family health team is like a one-stop shop model. So it's a family doctor's office, but has additional healthcare providers and services. And these services might be mental health counseling, physical occupational therapy, other assessments by dietitians, respiratory therapists, pharmacists, etc. And these services are usually covered by OHIP, similar to your services with a doctor. There are some exceptions, but for the most part, if you're part of a family health team and the services are offered there, it's covered. So the idea is that we have more cohesive care because it's all within the same team. All our documentation is within the same team. So all the providers at the team are aware of the care management plan for the patient. So specifically, my role as a family health team pharmacist, I have access to the patient's chart. I can see all the provider's notes and reports, specialist reports, as well as patient labs. And that's very helpful for me in my role to understand certain why medication therapies are chosen, or if I'm doing consultation on recommendations, it really helps for me to see, even patient labs. So that's a little bit different compared to, your pharmacist community who can still communicate with your family doctor. But being part of the team, I have that direct communication working side by side with my colleagues who are your family doctors or other healthcare professionals. And also we even send messages through the chart. So it's really direct communication that way. And of course, because we know exactly what our colleagues does and what services they provide, we are able to make appropriate recommendations to our colleagues as well. For example, if I have a diabetes patient and I know they're really struggling with finding the right food options, I know our dietitian can provide that care and I can directly refer the patient to our dietitian. More specifically about the appointments with a pharmacist. So I would say it's very similar to what a community pharmacist can do in terms of, if you've heard of the Meds Check program, but my appointments tend to be a little bit more in-depth and longer. So it could be, if it's more specific for one medication, it might be 15 minutes, but sometimes my consults can be up to like an hour, depending on how much you're going through. And I have that time set aside to do it, including detailed discussions about supplements. And sometimes I do a little bit of detective work because patients have, maybe they see multiple specialists, and one thing gets started and then something gets stopped, and oftentimes a family doctor may not be aware. So a lot of times in the background I might be going through those reports trying to figure out why we were started on a certain medication, and does it make sense now, because sometimes medications are in conflict with each other. So your heart specialist might focus on one thing, but your kidney specialist might say that's not the best. So as part of the primary care or your family doctor team, we can kind of help navigate that and communicate with a specialist that way. There's also a big focus in my practice and most family health team pharmacists to do chronic disease and patient self-management. So the idea of that is, first of all, we want to educate patients so they can manage their health conditions at home before, and hopefully before it progresses or gets worse. So we want to actually help you develop those skills. So as an example, I'm part of the diabetes management program, and a lot of that is that one-on-one consultation about, okay, how do we use our glucose monitoring devices? How do we take our medications? What are the appropriate ways to manage your low blood sugars? How do we manage our sugars around exercise? Food, and basic information about food and diet. So those are all things that we talk about, and that's more in depth than your follow-ups with your doctor, for example. And other programs I also like to mention, similar to the community pharmacy, we talked about how it's so important that the pharmacist can demonstrate the use of inhalers, and sometimes the further expansion of that might be to actually have action plans as well. So with a chronic disease like asthma, we know it's gonna sometimes it's really stable, and sometimes you have flare-ups where you get more wheezing or other symptoms, especially during fall or allergy season. So you have a plan in place to know when you can use your inhalers more and which one to use and what to watch out for before you have to go to the family doctor for more care. So we focus on that kind of self-management. The other clinics or programs that other family health teams might have, and this is similar to some of the programs that the community pharmacies might have, is like we talked about. I know community pharmacies might have the cholesterol clinics, right, where they check your cholesterol levels. So similar to that, we have hypertension clinics where it might be the pharmacist and another healthcare provider who helps check blood pressure, look if it's within their target, and management. Other things like heart failure clinics, anticoagulant clinics. So that's with that. We talked about that warfarin therapy, as well as sleep therapy clinics. So talking about sleep hygiene and those practices. Again, part of that self-management and furthering those chronic disease education. For medication management, I like to say that it's somewhat similar to what a community pharmacist can do, but because we are working with the doctors directly and not independently in the community, so to speak, our community pharmacy, so to speak, we oftentimes, the pharmacist and the family health team, they can still do the start, change, or stop medications, but usually in consultation with your doctor. So oftentimes it might look like a medication directive where, the doctor has, for example, as a diabetes educator, if it's within diabetes management, I've gotten that permission to make those adjustments for your insulin therapy that I don't necessarily need to go back to the doctor for permission for. But that's all discussed ahead of time. So it's very specific to your medication condition and what kind of services I'm providing at the clinic. A lot of times too, my work isn't necessarily about just the medications you're on, but also that in-depth counseling piece. So for example, there's a lot of times where, as you may be aware, there's a lot of times medications are back ordered. So the manufacturer doesn't have enough supply, you can't get it at your pharmacy. So what do we do instead, right? Because it's often not safe to just suddenly stop medication. So one of my roles is really looking into what are the alternatives that are appropriate for you based on what we know is available. And I often work very closely with your community pharmacy because, again, ultimately I need to make sure my recommendations are actually available, but I have access to, your chart, your specialist, hopefully to kind of come up with that plan that works for you. The other things that we talked about earlier as well is like if medications are too costly, what can we do, right? So I'm not an official medication reimbursement specialist, but sometimes I do end up doing some of that as well in terms of like what can we do to help with medication costs. And finally, sometimes patients are very rightly so hesitant about starting certain medications because not everything is there's side effects for a lot of medications, right? So we're always having that detailed discussion about starting medications. What are the risks, what are the benefits, and helping patients making that informed decision so that they're comfortable with their medication therapy and understand what to watch out for, and what to do if they do have side effects. But often it's about that discussion so they feel comfortable with even starting a medication and not just because the doctor told them to start something. So again, other things we talked about in terms of navigating the healthcare system is about that looking at medication alternatives. And this is where I really do communicate a lot with your own pharmacy because, they're the ones who are also helping you with dispensing. Sometimes there's insurance information that I'm not privy to. So I communicate with the community pharmacists as well to understand that. And I talk also as well about we call it advocacy or system navigation. A lot of times talking with other healthcare providers. So that may include your specialists. Sometimes it could be patients who have like nursing care. So I make sure to talk with the nurses who might be helping with administering medications to better understand, like, is there any side effects that we need to watch out for or any issues that we need to watch out for. So finally, for having some tips about having meaningful conversations with your healthcare team. When you go to your family doctor's office or even seeing any specialists or any of your providers, I recommend that you make a list of the important topics that you want to discuss. You may not have time with the family doctor to discuss everything, but it would be important to be aware of like your top few priorities that hopefully you can tell the doctor at that top of your appointment or at the beginning of your appointment, so you can prioritize that so you can maximize your concern, your time talking about that particular concern. Also, when it comes to talking about like to your pharmacist, you often, for example, because I'm part of the family health team. So if you had a particular concern about a medication that's related to your health condition, sometimes I'm able to talk to your doctor or your specialist on your behalf. So, your healthcare team or even your pharmacist in the community, similarly, they can also send a note to your doctor as well. So don't be afraid to ask if you have a question and maybe you didn't have an opportunity to talk to your doctor, your pharmacist may be able to help you with that communication piece. And also because, again, like my role really is everything but the dispensing. So especially if you have access to a family health team pharmacist, I really recommend that you book that appointment. There's additional time and support for you to really discuss in more detail and depth about your medication therapy. And I always recommend patients to know why they're taking the medication, what to expect from it, what are the side effects, so that you're aware of how to manage your own medications. So where do you go for more information? I'm going to hand it back over to Eugenia to talk a little bit more about that.
Okay, so if you need help with your medications, obviously you can go back to your local pharmacy or the pharmacy that you usually dispense with. But at UHN, we do have 5 outpatient pharmacy sites. So that includes Toronto General Hospital Outpatient Pharmacy, Transplant Outpatient Pharmacy, and Clinic Pharmacy. So these 3 pharmacies are all within Toronto General Hospital. Then there's also Toronto Western Hospital Shoppers Drug Mart, and there's also Princess Margaret Outpatient Pharmacy. So these 5 UHN outpatient pharmacy sites are always available to help assist if you ever need any support with your medications. And to note, 100% of the proceeds from these pharmacies actually go back to servicing UHN departments and the services that it provides. So really, we do encourage UHN patients to use our outpatient pharmacies. Also on site, we do have medication reimbursement specialists. This is something that Alice, brought up in her caregiver experience as well. But the medication reimbursement specialists do help to navigate drug coverage and to help ensure that you're paying as little as possible out of your own pocket. Although local pharmacies don't have this particular role, pharmacists can still take part in helping you out with options as well.
Thanks, Eugenia. That's really great to know what's available at UHN. We also wanted to provide some resources that are available in the community and online. So you can apply for different Ontario public drug programs that help with subsidized costs of medication. If you're also looking for a pharmacist, you can find a pharmacist at the Ontario College of Pharmacists. And then if you're looking to get more information on the medications you're taking, such as the supplements, drugs, or any other herbal remedies, you can go to Mediline Plus or Drugs and Supplements by the Mayo Clinic. And we will have links to all of this below in the description box. And then if you are looking for an app to download on your mobile device, MediSafe Pill Reminder by MediSafe is an app that you can use to set reminders on when to take your medication. And finally, you're always welcome to contact the Patient and Family Learning Centers at UHN. They offer reliable health information to patients, families, healthcare providers, and members of the general public. All of their services are free. They're available in multiple languages. You can call, email, or visit the centers Monday to Friday between 9 to 4. And with that, that's the end of our formal presentation, but we'll go into question and answers now. Again, thank you to those who have submitted questions. We've got questions submitted from patients, caregivers, UHN staff, and also the general public. So we'll go through some of those questions now. Although please note, if you did submit a question, we may have removed your name and only included the question. All right, so our first question. How do we know if some of our meds are not interacting negatively with each other, causing negative side effects?
So I'd like to answer this question. As discussed, actually, Alice brought up this example previously. That's why we really recommend that you go to the same pharmacy for most of your medications if possible, because that's the way the pharmacy team are able to review your medications and catch any potential drug interactions so that they can counsel you, or if there is one that requires a change in medication therapy, they can contact your doctor or a specialist or whoever had prescribed it. So that's so important to do if you can. I know sometimes, like if you go to a specialty pharmacy, you may not be able, you have to go to one pharmacy to get one specialty medication. But for the most part, I think most of your pharmacies should be able to help you with getting most of your medication. So, always try your primary pharmacy first. And that would be my advice for that.
Thanks, JD. Okay, our next question is, do you work with community pharmacies if a patient wants to use their local pharmacy, such as ensure the same quality of medications? Eugenia, I think that's a good question for you.
I can take this one. So we do work with local pharmacies in the sense that we can transfer patient medical profiles or the medical history over. So this actually commonly happens, for example, in our transplant outpatient pharmacy, where most of our transplant patients use our transplant outpatient pharmacy when they first are discharged home. And then after several years, when their condition gets more stable, they do choose to use a closer pharmacy to home, so their local pharmacy. And at that time, we would actually transfer the whole medication profile over. But we don't work with the local pharmacies in the sense that we can't ensure that your local pharmacies will provide exactly the same level of service because each pharmacy is really separate entities. So they kind of all run their pharmacy operations in a different way. And also we don't have access to each other's files, right? So, we can work together in the sense that we can share information, whatever we're able to share, but we don't work hand in hand on a regular basis. Now, in terms of ensuring the same quality of medications, all medications that pharmacies dispense really come from the same suppliers. So in terms of the quality, it would be the same. It's just a matter of where you're getting the medications dispensed from and where you as a patient are picking up the medications from.
Thanks, Eugenia, for that answer. Our next question is, are we able to schedule a consultation with a pharmacist at UHN to understand if Paxlovid is an appropriate treatment for a given individual for planning purposes, even though one does not have COVID-19?
Okay, I can take that question as well. So right now, Paxlovid is really for patients who are COVID positive. So pharmacies don't usually provide consultations if you're looking at pre-planning purposes. So for example, if you wanted to go away and you wanted to bring some medication with you just in case you get COVID, that's actually not available right now. And so it is very hard to do because we kind of need all that information about how you're doing at the time you're COVID positive to determine whether Paxlovid is a good fit for you. There's also certain criteria that we have to meet in order to give you that medication. So I guess my simple answer is for pre-planning purposes, the answer would be no.
Thanks, Eugenia. Okay, our next question, is there a portal for patients who receive medications from a UHN pharmacy to check the dispensed medication history, request for refills, and request for a report for tax purposes? Okay,
so I will take that question as well, since I have the 3 outpatient pharmacies here at Toronto General. So UHN actually has the My UHN portal. So that portal does not allow you to go in and refill your medications automatically. But for our 5 outpatient pharmacies at UHN, we do have a separate pharmacy portal. You just have to sign up with the outpatient pharmacies. But once you sign up and you're enrolled into the app, the portal does allow you to refill medications online. So you can actually see your history in there as well, see if there are refills, and if there are no refills, you can actually just hit a button and it will automatically prompt the pharmacy to send the doctor a refill request. So apart from that, like I said, you can see your medication history, but you can also sign up to get alerts so that the app will remind you when you're almost due for a medication. Now, in terms of a report for tax purposes, because these reports do require a physical, pharmacist signature for it to be valid, unfortunately, they cannot be printed from the portal. You would have to actually call the pharmacies and request for that report. And then once it's generated, the pharmacist signs off on it. You can then pick it up from the pharmacy. And usually this is, free of charge service. We don't charge anything for these reports that are required for tax purposes.
Thanks, Eugenia. All right, so our next question, different pharmacies have different opinions on drug use. How do I resolve the difference in opinion? I asked the pharmacist whether I can take my multivitamin with amphetamine and was told to separate them apart. My pharmacist has shorter hours, so I called another, told me it doesn't matter later.
Yes, so I can answer this question. I think if you're not sure, my advice is to ask the clarifying question. So if you, especially if you hear a difference of opinion, I would ask the pharmacist or whoever you spoke to why they're making that recommendation. So for in this example of the multivitamin with acetaminophen, if the pharmacist has suggested to take it separately or space them apart, ask them what's the significance of it? Is it a true drug interaction, or is it just to, maybe they're concerned about like just maximizing the timing but if I looked at this question, I would also agree that it probably doesn't matter. So something like this where it just be important to figure out where, if especially if you get a difference of opinion, where it's coming from, right? Because some interactions are very clear, you definitely have to space out. Sometimes it's just more of there might be other factors in terms of like logistics or when to take them that they want to be more clear on.
Yeah, thank you. Those clarifying questions are really important to ask. Alice, did you have anything maybe you wanted to share based on your experience?
Yeah, I think just as I said earlier, I mean, I know there's, a care team, maybe many pharmacists, but, my view is I try to identify sort of the primary team or the primary pharmacist. So again, because my kids' drugs are so critical, if I had a different opinion from another pharmacist, I would probably go back to TGH, the transplant pharmacy team or the outpatient pharmacy team, and ask specifically, how would this affect their primary meds?
Yeah, for sure. Thank you for sharing that. Okay, so we'll move on. I think this might be our last question. How do I know when to see a pharmacist versus my family doctor? If I get prescribed something from a pharmacist, will my family doctor come to know of it and add it to my file?
Okay, I can take that question. So when I talked about minor ailments earlier, and that list that I shared with the minor ailments, everyday problems that we experience, those are the health conditions that you can really go to a pharmacist to get recommendations for. Also provided that you meet the criteria that I had discussed earlier as well. So it's you're not on any medications that indicate a more serious condition, or you don't have like any major medical conditions. But those are sort of the things you can see a pharmacist. If you're not sure, it's always good to start out asking a pharmacist first. And if needed, a pharmacist would then, refer you to see your family doctor. Now, if you do get prescribed something from a pharmacist, what we usually do is we'll give you the prescription, but then we will also notify your family doctor that we've given you this prescription. So this is basically for continuity of care. We do want to make sure that your family doctor, family physician is fully aware that we've prescribed a medication for you, because it would be good for them to have this on their records as well. So you can always share that information with your family doctor, but we actually do it for you when we provide the prescription.
Thanks, Eugenia. That's really good to know. And patients will really find that helpful as well, that a pharmacist is able to do that. So that brings us to the end of our questions. Wanted to take a moment to thank JD, Eugenia, and Alice for speaking, sharing your story and your experience. And what a pharmacist does. It's sure to help a lot of people who are watching. Your feedback is also really important to us. So if people can go to the QR code or the link below and fill out our feedback form, this will help us to know what we can improve on, what topics you would like to see in the future. That way we can tailor our health talks to what you are looking for. You can also subscribe to our newsletter to keep up to date on health talks, subscribe to our patient e-newsletter, and get up-to-date information about events and new events at the University Health Network. You can subscribe with the link on your screen. The link is also available on the confirmation page of the feedback survey after you fill it out. And then our next topic in November will be honoring Transgender Day of Remembrance, looking at trans experience in healthcare. So the virtual presentation will be available here on YouTube on Monday, November 20th, right in the morning. Thanks again for watching this session, and we hope to see you next month.